What are the different types of parathyroid scans and what is the reason for doing these scans? I'm Dr. Babak Larian for Center for Advanced Parathyroid Surgery. Hyperparathyroidism is I don't know how to describe it. It's a wild disease. It's mysterious in the way it comes on. It's hard to diagnose sometimes. And then once you diagnose it, you got to figure out if you have parathyroid adenoma, which is a singular tumor, or if you have all four of your glands involved. And rarely some people have two gland tumors, two adenomas or double adenomas, right? The treatment for each of these different situations is different, right? So if you have a singular tumor, which means a single cell in one gland here grew and became a tumor, right? As here. And in the process, the normal parathyroid glands all shrank because they weren't working. So the tumor was producing excessive amounts of PTH while normal glands are shrunken and producing a lot less hormone. When you do surgery for this, if you can find this abnormal gland and go into surgery just removing this gland and not going in there and touching these other shriveled up smaller glands, right? Then that's a minimally invasive surgery. Now, when you're a parathyroid expert, you can easily find these glands. That's not an issue. The issue is that these glands are smaller, so the blood vessels going into them and the blood vessels coming out of them are smaller. So the chance of injury to these glands or any of these vessels is high. So if either the gland gets damaged or either one of these blood vessels get damaged, that parathyroid dies, right? So if you're minimally invasive, you go in and you only touch this gland and then don't touch the other ones, you don't run the risk of creating a new problem, which is low parathyroid function. And the beauty of modern day medicine is that with the advancement in parathyroid surgery, we have PTH testing. So when you have hyperparathyroidism and these three are producing very little PTH and this one has hijacked the system and producing massive amounts of PTH, once you take this out, 5 minutes later, you can check your parathyroid hormone level, and because the half-life of PTH is less than 5 minutes, it should go down dramatically, right? Which will tell you the other three glands are not overworking and you don't have to go look for them, touch them, see them, or potentially cause them harm. If you have hyperplasia, all of the glands are abnormal and all of them are producing excess parathyroid. So if you do a scan, all the scans, and you don't see any, then that increases the likelihood that you have hyperplasia and all four glands may be involved. So before surgery, you kind of are prepared for the possibilities. And the patient is prepared for the possibility, most importantly, okay? Now, what are the different scans? Ultrasound, which is my absolute favorite, followed by 4D CT scan, which I love also. The Sestamibi SPECT, which is probably the most commonly used scan and my least favorite scan, and I'll explain. And then the experimental PET Choline, experimental in the US, very much used frequently in the UK and in Europe. So the ultrasound has no radiation. The Sestambi has a fair amount. The 4D CT has also a fair amount. But when you go to someone who has expertise with doing a 4D CT scan, they can reduce the number of images and bring down the radiation exposure. And the PET Choline, which has a low amount of radiation exposure. Ultrasound. I do my ultrasounds myself on all my patients, even if they've had a previous ultrasound. There are times where the person has an ultrasound, they don't find it because the ultrasonographer was more interested in thyroid disease than parathyroid. And they come to me and I'll do an ultrasound and I find it. And this is an example of one. Let me show you again. So this is cross-section in this orientation. Head is this way, feet this way. This is the thyroid gland. This is skin and fatty tissue under the skin. This is a thin layer of muscle. And this is the parathyroid with a distinctive dark look and a white shadow, right? This also shows blood vessels, showing a blood vessel that's coming in to feed the parathyroid. So it gives you very good anatomy, gives you blood flow and relationship to other structures. And there's examples of more of this. Thyroid gland, which you see here, and then the parathyroid underneath it, which during surgery, you can see it's very much the shape of the parathyroid that was removed. Again, here, the parathyroid seen on the scan with a white shadow, right? And then when you took it out, it's almost exactly the same shape. And I know where the blood vessels are in relation to it. So I really think ultrasound is fantastic. And what ultrasound can also show you thyroid nodules, right? And you can decide if during the surgery, I can remove the parathyroid and maybe go in there and just scoop out that nodule without harming the rest of the thyroid. So it really gives you a lot of good information. The Sestamibi scan in the original form looks like this. It's a very vague scan. You can see the sides of the head and neck of this person and then shoulders. At 15 minutes, the scan is showing both the thyroid gland and the parathyroid. At 2 hours, the thyroid is fading and the parathyroid is not fading as much. So again, what you're looking at is something very faint. This is not a very clear scan. And the problem with it is that this scan is looking at the mitochondria or the factory of the cells that are overworking, right? So the thyroid is working a lot and the saliva glands are doing it, the heart is doing it, and so on, right? Other tissues can be overworking and masquerade as the parathyroid on this. So it's not specific for parathyroid, it's specific for the factory, the engine of the cell, right? So it is most useful when the person's PTH is over 150 because the factory is working hard, producing a lot of hormone, and so it's more likely to be accurate. It's 84% accurate when the PTH is over 150. It's less than 50% accurate when the PTH is less than 100. That's when you need it the most, right? So it fails. When you combine it with a CT scan, so you display the images of the Sestamibi on a CT scan. It's called a SPECT scan, and it gives you better anatomical location, right? It is better, but still it has inherent issues. I rarely order the scan. I really order it when the other scans are not showing me anything, and I really feel like potentially there may be some help there. I love the 4D parathyroid CT scan, right? And I have a relationship with my radiologist, so I can let them know to decrease the number of images so they can decrease the total radiation dose to something that's more acceptable for me, right? And this scan is amazing. So in this image, which is a cross section right here, you can see the breathing tube, which is the dark circular structure, right? The thyroid is here going around it, right? And this is the esophagus, right? This is before giving the injection. Once the contrast injection is given, the blood vessels light up, right? The esophagus is still looking the same. Thyroid gland lights up because the contrast is made up of iodine. And then the abnormal parathyroid really lights up, right? And if you wait another 60 seconds, the thyroid still holds on to the contrast because it's iodine based, right? Most of the contrast is leaving the blood vessels and the parathyroid quickly lets go. So the fourth dimension or the 4D is time. With time, the parathyroid that had no activity without contrast and massive activity at the initial stage of contrast loses the contrast. You can clearly see where the parathyroid is, what the relationship to blood vessels, esophagus, breathing tube, thyroid, everything else is. It is a very exact GPS as to where you're going and where you need to be. It can also, you can see another parathyroid right here. And this is a side view, profile view, front of the neck here. This is the parathyroid, and you can see the blood vessel coming into it. This is the frontal view, again, the parathyroid, and the blood vessel coming into it. So it really gives me exact anatomy, and very important for parathyroid tumors that are deeper and the ultrasound sound waves can't get to them. There is such a thing as a 4D parathyroid MRI. We don't use it as often. We really use it only in people who are allergic to the contrast, really allergic to the contrast material for a CT scan. They have iodine or shellfish allergies and get anaphylactic and swell up and can't breathe, right? If the allergy is milder, we can give them steroids and do the 4D CT scan. The reason we don't favor the MRI is because even in the best of MRIs, the distance between each slice of an MRI is 3 millimeters, while the distance between each slice of a CT scan is 1 millimeter, right? So in an MRI, a smaller parathyroid that may be slanted or sideways can be missed. The slices can just miss it or just get a little bit of the edge and not really be able to say what it is, while the CT scan clearly has more slices going through it and see. But it is a tool in our armamentarium. The choline PET scan is a really interesting scan. It's now more commonly being used in Europe, and we're doing experiments in the US to get FDA approval. It is FDA approved for prostate cancer, so it is safe to do. We're just trying to figure out how it fits into our healthcare system, right? It is a very good scan. It has very good accuracy, and once it becomes more readily available, we'll hopefully be able to access it and use it more often. If you're interested in clear parathyroid information and need help with what to do next with this very confusing disease, visit us at parathyroid.net. Like this video, subscribe to us, and ask us questions so I can answer more of your questions and be more directed to help you. Be well.